reforms at the request of the Ministry of Healthcare. And now this is the ministry, and the minister is the representative of the government that really wants to discuss this topic and to take into account the feedback. So if all the changes happened in the country like this, we believe, and it shows, and Mr. Groisman also supported this idea. So we implemented this in practice, and when we say about the focus of our survey in the region, we say about full cycle of public policy, and all the proposals, all the changes, they are discussed with the stakeholders or target groups influenced by this change directly or indirectly, in order to take into account criticism and to have a constructive dialogue and to decrease the risks at the stage of the concept, in order to have the document in the parliament that will be of quality. It should not contradict other legislative acts, and it should be supported by quality implementation. When we speak about healthcare reform, so we tested and we gathered feedback and recommendations of the local government, doctors, patients, and this was about the peculiarities of the implementation of reforms, the concept that was voted for, and the government based its activity in it now. And in each of the cities, we met different audiences. We spoke with the local government, party organizations, and the medical community, local businessmen, students. So we worked in different formats, and in the 6 months of our regional tour, we were able to attend 22 oblasts and to work in more than 60 cities. And in each we had a number of public events, and we had more than 250 events of different formats on reforms of democratization. And 10,000 Ukrainians participated in discussions of proposed changes. Out of them, about 6,500 are doctors, those chief doctors of the hospitals, doctors and students of medical educational institutions that will soon become graduates. So we presented the results on the site of Center UA. These are public reports, analytical materials, and they sometimes it is difficult to read them, but it is easy to work with them if you are an analyst, and also you may make changes due to these reports. And I would like to invite Oleksandr Yabchanka, expert of the Reanimation Package of Reforms, and he will tell about the what is in the focus in the medical reform, and then we will also want to hear the Ministry of Healthcare representative, Ulana Suprun, active Minister of Healthcare, and how these events influence the reform in Ukraine. Thank you, dear colleagues. I'm Oleksandr Yabchanka, and I'm a medical reform expert of the Reanimation Package of Reforms. For the last half year, we were on a tour to create a full cycle of public policy. So what was the reaction to our visit? So this is a slide you may see how students respond when the minister visit them. So they are in a proper attire, but first the minister said maybe you should that we just wanted to communicate, to speak to them, not just to put them in this nice uniform. So this was really interesting format. Because when I was a student, I would be surprised if a minister came to me and asked for advice. And now this is the reality of our work. So what is expected from this reform by doctors? First, according to current system of financing, the doctor gets about 3,000 hryvnias, and he has only two options: to treat a patient and wait for the remuneration from the patient. So he can be only a beggar or a racketeer, and that's why doctors, they do not like it. And first, they want proper conditions for their work, and then they expect a good salary for their work. And what is proposed by the cabinet, that money should follow the patient, and on this the salary of the doctor will depend, and the doctors like this idea. About the accessibility of healthcare services in rural areas, we heard a lot of myths, and maybe the most widespread myths, the first one, that the doctors will be fired, and the second myth, where we can find new doctors and why should we fire them and to get new ones. So these are the myths that just contradict each other, and these myths were more in rural areas. Why? Because now, in current system of financing, the doctors, they openly do not want to go to rural areas, because officially they will get 3,000 hryvnias, and there they won't get additional payments, and they do not like this, and this is the reason. And they asked what will happen, what will be the motivation for doctors to go to rural areas. Next, training of new generation of medical workers. Our system should be better, and recently they wanted to increase the score for entering the institutions up to 150, and some deputies opposed this, and society and medical workers, they want to have this quality personnel, but there is no proper response from the deputies. So what doctors demand from the Ministry of Healthcare? First, to decrease the dependence of reform on the officials of local government. The example, 2 regional hospitals. It happened in Dragobich region. Dragobich Regional Hospital accepts a lot of patients from adjacent regions, but the money goes to these adjacent regions. This is how the medical subvention is provided. So they do not get any money for this patients that they get from other regions, and they ask a question, and they ask the local government, and they say, take this money from the adjacent region. And local government from that region said that the local councils, they do not want to provide this money because they have their own hospital. So doctors say they do their work, they treat the patient, and they depend on local government body of the neighboring region. So there are a lot of situations like this. Second, what doctors expect is to provide calculations for different types. So they say that money should follow the patient, and we understand that in current system of financing, we will have more money, but how can we efficiently use this money? that was the biggest request from the regions. Also to decrease the number of paper documents. When we speak about e-health, they have hope in their eyes, because you understand that they really write a lot, and maybe no other, there is no other profession where people write so much. So they really complete a lot of different documents. Next, liberalization of requirements to facilities. There are facilities that are not used in hospitals, but hospitals have to sustain these facilities. They have to provide for them. And that's why they want this to be changed. And also individual licenses. What doctors want? They want freedom. They want to be independent professionals. They want that medical institutions compete for them. And now a doctor, he cannot work elsewhere because only medical institutions, they have licenses. So doctors are attached to these institutions and they want to be independent and have their own licenses. The next one. What doctors ask, what doctors demand. They want to have clear rules because the state and constitution provides that medical service is provided free of charge, but when a patient comes, 95% of medicines he buys at his own expense, and then he provides money for charity funds, directly pays to the doctor, and the state promised free of charge services, and shifted this responsibility on shoulders of doctors. So the doctors, they provide the promise, deliver the promises of the state, but the state didn't support it financially, and this is absurd. And the state makes us guilty for its own populism. So this is the statement of doctors to the ministry and to power on the whole. Next. Concerning information campaign on medical reform. Now we face the situation. There are many myths that are reflected, and the people, they ask what will be with this reform, and the doctors are underinformed. And during public consultations, we had one attitude toward us when we came, and when we left, people had different attitude towards us. So when you communicate to chief doctors about all the components of the reform and why they need this reform, they start to communicate among themselves. They ask questions, and the chief doctor may then ask, do you implement this or that document, so they can ask proper questions. So medical students expect, they want to choose their place of employment. To help with employment. So from one side, they want independent choice, and from the other, they ask for help to be employed. This is maybe about myths and about quality conditions at workplace. And we asked a question to the students of graduate year. We asked what is needed in order that you were able to go to rural areas to work. First, they said about conditions at workplace. People want to be professional, then salary, then housing. So they want to be provided with proper for housing, and also they want to have a car. In this way, they will be able to go to the patients in remote areas. So this is the issues concerning rural areas. Here, local government should help. So what local government bodies expect? Financial support. Reform is good, but without additional financing, reform cannot be implemented. So they want to have resources for the implementation of this reform. Then recommendations how to organize work. What happens? They say this is good. You've shown this to us that we will have more money, but what can we do with this money? We are budget institutions. We have what should we do with all this infrastructure? This was the requirement from local government and consultations for the local government bodies on organization of medical services. So they have some infrastructure, personnel, patients that live in this area, and they need to be more efficient, and they want to be provided with the recommendations how to work properly. Also, the law on automation, and this law was registered in 2015 in July and adopted in spring this year. So the dynamics of work of Supreme Council is really low. So and they adopted the draft law on autonomization. And when these recommendations appear, we started this tour in winter, and now we are in the summer, and a lot of things changed. So they said about automation, but we provided the recommendations from the ministry, and they really liked it. So I give the floor now. So, Oleksandr, stay here. This is our brief conclusion. We are able to answer questions. We faced many different situations there. We traveled not alone, but we were joined by Dr. Suprun or the other representatives of the ministry in order to provide proper communication and to respond. And please share with us your impressions about the communication and the response from the regions. Is it included in your work as a ministry?
Thank you. You see, a lot of work has been done during latest 6 months. We were touring together in cooperation with Sasha and Center UNGO. We visited all regions. There were more than 70 visits and consultations. We talked to 6,500 doctors, medical students, plus 5,000 local authorities, representatives, and patients, organizations, patients themselves, and grassroots public who wanted to hear about the medical reform. It is important to understand that we visited and say not only what reforms will be happening, it was a dialogue, interactive dialogue with doctors, local authorities, medical students. We presented ideas and visions which we have, which we developed in 2015 when special expert team provided recommendations to Ukraine to change the funding system on the healthcare sector of Ukraine, and we listened to these recommendations, and now we listen to the feedback from local authorities. The changes according to recommendations of 2015 were included into our legislation and our concept. Those who were together with us at our meetings, who heard us and who organized this to all of us authors of the two legislative bills, 6327 of the draft law and 6704. We understand that these changes to the code would be very important. The reform of the system will start from the primary aid, and we heard that this is the right step. We were said so by local authorities during the consultations. There should be more family doctors in urban and rural area, and these doctors should understand what services, medical services they should provide, and we have strictly outlined this list of services and the equipment which doctors should have, and the documents have been already developed upon our consultations with doctors, students, and local authorities and general public. Many documents developed in response of our consultations. In follow-up of our consultations, and now we are developing the document how local authorities can work in order in the best way to implement the changes in the funding system which we propose now and which are expected for vote to be voted for in the Verkhovna Rada. A lot of work have been conducted in the scope of Prime project, and we hope that the changes to the legislation from 1st of January 2018 will be implemented in the primary medical end, and we will continue working with Center UA and Reanimation Package of Reforms with our friends. We have already developed the vision of this medical reform, but we should not stop and talk about the implementation of these reforms, because we have already experienced that sometimes our laws in Ukraine are developed in a very good manner, but if we do not implement them, they remain on paper alone. And the next step is to cooperate further with our colleagues, to have consultations, to get feedback from communities, doctors, patients, how to best implement the changes which are already included in the laws and will be, we hope, will be voted for in the Verkhovna Rada this week. As we see, there are very constructive recommendations of the consultations. Sashko represented already these comments from our public. We were surprised that many things proposed by the doctors coincided with our opinion. For example, licensing, individual licenses. We used to the myth that doctors do not want licenses, that this would be more work and more money they should pay. But when we talk to the doctors and medical students, they want to see individual licenses of medical workers, in particular doctors. This gives them freedom to change their positions, to change hospitals if they do not like the institution, or for their just private reasons. There are many things which we didn't expect to hear. We didn't expect but we found out how many guidelines we need to compile for local authorities in order to help them to to shift to other system of funding because they have no understanding, they lack understanding of this funding reform. As Sashko said, when the chief doctor and the head of local authorities communicate, this was the first time they communicated how to improve financing system in the medical sector. The most important result is that there is support from the medical community and the patients and the general public and local authorities of the philosophy of changes how we fund the system of healthcare. Instead of funding buildings, we will fund services. Instead of funding communal salaries, which are very low, we will pay to medical staff for the amount of services they provide to patients. We will support good results instead of supporting just existence of buildings. I think that there's support of the philosophy of funding was the most important thing which we got as a result of our consultations, and I hope for the cooperation, fruitful cooperation and dialogue with medical workers and medical community, general public, patients, because we will be ready to shift to the implementation of this system. Nowadays, Verkhovna Rada has two bills on the agenda, 6327 and 6604. The first is fundamental changes to the funding of the healthcare sector. This is the first step of changing the system. We need it very much to be voted this week in the Verkhovna Rada. Last week we worked with the work group in the parliament to prepare all these 886 amendments to the draft law provided by 70 MPs to this draft law. We work and now we are ready to finalize this work today, so that tomorrow the Committee on Healthcare will consider this amended draft law. By Wednesday, we expect to have the opinion of the committee, and on Thursday we hope voting on the agenda for this draft law. And I call on all MPs to make this important step to change significantly the healthcare system in this country. We have been waiting for 26 years. It's just the right time to start moving to the future. Thank you very much. Thank you, Sashko. Thank you, Dr. Suprun. We have 10 minutes for questions. Natalka Prutka, Glavcom, mass media source. From the 1st of July, the experiment of the government started, in which 4 medical institutions take part: Shalimova, Mosova, Strazheska, and Ramadanova, and from the Medical Sciences Academy introduction, I understood this is a model reform which is implemented in these pilot institutions, and this reform will start next year. And Sashko said that there are problems with funding. Local authorities do not transfer money if a doctor, except they are the expert. If local authorities or state budget, national budget can't finance the doctor's services provided by the doctors, then patients will pay themselves for the services, which costs will be calculated either by the institution or by the Ministry, tell us please what are the amounts of funds budgeted and what are the amounts of funds to be paid for the services, what is the price services. These funds for institutions, this is a project which is conducted by the ministry and the cabinet of ministers together. This is an identification. This project is aimed to identify these prices of services. This is tertiary services. There are 200 million hryvnias transferred to these four institutions, and this 200 million hryvnias should cover the tariffs of the services of these institutions. This does not mean that they should take money from patients. There are 200 millions for the services. This amount is budgeted and it will be provided to these four institutions and will help us to understand what tariffs for the services of tertiary medical aid should be set, and we help them to set what services they should provide at this tertiary level and what should be the prices of these services, what is the procedure of payment of medical services in our system. A patient going to a primary aid doctor every month, funds will be sent to this doctor. You choose your primary aid doctor, you sign contract with him or her, and it is entered into the database, and the ministry will pay directly for you, for a patient, some money. On the secondary, tertiary levels, these are services. For example, some surgical operation is payable at certain tariff, and you go to a communal or governmental institution, you pay zero, and your medical insurance is used to pay for the surgical operation. There will be a package of insurance where all medical services are paid 100%, but for example, plastic surgery is not included into this is the second package, and there is also the third package which will be partially paid by the government. Nowadays, you enter the hospital and pay everything from your pocket. Instead of this, the tariffs will be set and the government will pay. And where the tariffs are too high for some services, the services will be partially paid by the state. But there are some also discussions that there will be non-paid services, but I think that some services should be co-paid because our state do not have enough financial resources to pay for all medical services to all patients. We can't say so because we do not have finances. Next year, we are promised by the Ministry of Finance that by 2020 the level of funding for healthcare sector will increase by additional 25 billion hryvnias. This is a big increase of funding. Because they understand that we will be more efficient in using this money and in getting results, but not just spending and wasting money for some people where there are many departments in hospitals, sometimes even not necessary departments, and they do not give services, and all patients go to paid private hospitals to cure. So the idea is that money will follow patients. The situation which you described is you described it very clearly, but these services provided now by the state free of charge. Now the services, payment for services is imposed on patients, or doctors should somehow provide their services free of charge. So the budget, national budget and local budgets, they should be, this budget should be used in the other way. Yes, there are institutions in which there are many patients, so these medical institutions should get more money, and there are really institutions which are not visited, but they are also financed at the same level as the medical institutions which are good and visited by the patients. So we have limited budget, 3.5% of GDP. This is our healthcare system budget, but we should use it efficiently. Thank you. It was a model question. We heard it many times in the region, so there's only proof that we should communicate more and more. We should have more and more dialogues.
Andrei Bikwich, in your presentation, among those requirements doctors have to these reforms, there is provision of information about financial model, how this money will be distributed. Did you calculate this? The amount of primary services and in other levels, how it will work financially? I will tell you what was done, what information they want to get. First, what information they have. On the example of amalgamated united territorial community, they know what medical infrastructure used in, for example, in 2017, they know about the stuff in this sector, and they can calculate the money that was spent, and they can also calculate per capita. It's about 210 per person in Ukraine in hryvnias. So this sum will rise from 210 up to 370 hryvnias per person. So if they make an agreement and put the persons in the single registry of patients, so you will have real patients in this list, and the ministry will provide motivation, and then we will speak about coefficients. They will model the situation for the next year. So, for example, the center that provides primary medical health services, they, for example, are responsible for 10,000 patients. Then they will see what money is allocated for per person, and if they put these patients on the green list, they need a software a computer program, and here the head of the center can make a proposal to the local government to provide computers to them, and then they will be able to put the patients on this green list. And when a patient signed a contract with a doctor made an examination and, for example, found hypertension and then prescribed some medicine to the patient. And the system will show that the better the doctor does his work, the more money he will get. And the doctor will be interested in signing this declaration. So do you have other questions? Please ask. So I would like to remind to you that this is one of the many events, and we are really glad that you are here today with us. And all the reports about proposals with the names of the doctors, you may find this information on the site of Center UA. This was provided by the Ministry of Healthcare, and there is still a lot of work ahead, but our experiment really worked. The citizens, they support the ideas, they understand. That's why we should put effort in order to establish quality dialogue, in order to produce understanding, not myths, among the patients in Ukraine. Thank you very much. Till the next time, thank you for this opportunity.